In this question, a 42-year-old woman is evaluated for minimal edema and urinary protein excretion of 5 grams per 24 hour. As a child and young adult, she frequently developed UTI. So as a young adult, she frequently developed UTI, and she underwent a surgical procedure to reimplant ureters in order to prevent urinary reflux. So she had a history of urinary reflux. This could be related, could not be related, but we have to take that into account. On physical exam, the blood pressure is 140/95. There is trace pretibial edema, so there is some edema. The remainder of the exam is normal. Lab studies show creatinine 1.5, total cholesterol 300 mg per deciliter, albumin 3.4 gram per deciliter, urine analysis 3 plus protein. So urine has 3 plus protein. Chest radiograph is unremarkable. Abdominal ultrasound reveals that the left kidney is normal. Okay, so the left kidney is normal, but the right kidney is small and difficult to visualize. So the right kidney is kind of atrophied. Which of the following is most likely causing this patient's proteinuria? So we have to find the reason she is having proteinuria. And there's 4 reasons that are given: A, B, C, D. First of all, we can rule out minimal change. That is usually seen in young kids. Plus, minimal change is also seen after an insult, for example, UTI or respiratory tract infections. This patient had a prolonged history of UTI, so much so that she had to get surgery to implant ureters. That was quite serious, right? Okay, now what are we left with? We're left with MGN, focal segmental, and MPGN. MPGN, from her history, well, MPGN is caused by hepatitis B, hepatitis C can cause MPGN, and a decrease in C3 nephritic factor causes MPGN. I'm going to rule that one out because here this vignette really does not go with the story of MPGN. Now we're left with B and C, MGN and focal segmental. By the way, what is the most common cause of nephrotic syndrome in adults? Number 1, focal segmental. Number 2, MGN. In this case, it's therefore going to be focal segmental because we don't have enough information to really pinpoint what the disease is. So I have to think that the most common is going to be focal segmental. But wait a minute, I have information which is kind of not present on first aid. It turns out that having a vesicoureteral reflux disease makes it more prone to have focal segmental. So now I'm double sure that C is the answer, because not only is the most common cause of nephrotic syndrome in adults, it also causes nephrotic syndrome due to vesicoureteral reflux disease, which this patient had for a long time, and that's why she got the surgical implant. So in this case, C is the correct answer.